everyone, my name is Alicia Brenner. I'm an alumna of the class of 2021, so not too long ago. And since graduation, I've been in residency. So I did a PGY1 residency at Methodist Dallas in Texas. And now I'm down in San Antonio doing a PGY2 in solid organ transplant at University Health. So pharmacy residency is postgraduate training that you can pursue. It's optional, it's not required. It's something that you look into if you want to most oftentimes go into more of a clinical pharmacy setting, but there are so many different options and areas that you can pursue. I encourage you to look at the ASHP website because they have a list and information on all of them. For me, I did a PGY1 and PGY2 as separate programs. So the first year of residency is more so general, kind of going through different areas of pharmacy within the hospital, getting exposure to everything and just giving you a really good baseline knowledge. The second year of residency is more so if you want to specialize in a certain area. So like me, I picked solid organ transplant, but there's so many options like critical care, emergency medicine, ambulatory care, the list goes on and on. So there are a lot of different things that you can pursue as a second year of residency if you really want to specialize in something and you're really passionate about it. The match process looks almost the same for both of them. Generally, when you're looking at a PGY1 residency, this starts kind of in the fall of your fourth year of pharmacy school. When you start looking at different programs, you have ASHP mid-year in December where you get to meet people from those programs, kind of get your list pared down to what programs you're really interested in. And then you have applications and interviews taking up January and February. And then in March is when you find out where you actually match with a program. So all of that information is it's a really short version of what it is, but it's the same process for PGY1 and PGY2. The big difference is that PGY2, you can do something called PPS at mid-year. So it's personal placement services, if I'm remembering correctly. And it's more of like an intimate one-on-one session with program directors, possibly residents. And by that time, you kind of know what you like in a program and the pointed questions that you want to ask. So it gives you, again, a more opportunity to talk to them and get to know them before actually applying and interviewing. I really enjoyed that part of it because I feel like I got a good sense of the people there, even just by talking to them for like 30 minutes. So that's the big difference between first and second year residency match process. In pharmacy school, I was one of the interns at Tampa General Hospital, so I was exposed to hospital pharmacy really early, and I really liked it and wanted to do that every single day. So I set off on the path to pursue residency throughout the rest of school. In terms of deciding whether to do just 1 year or 2 years, I also always loved transplant pharmacy, and I stuck with it pretty much the whole time. I never really changed my mind on what I wanted to do, what I wanted to specialize in. I definitely had moments where I didn't know if I wanted to do a PGY2, as most people do, but eventually I landed on it, and I'm really, really happy with my choice and so excited for the rest of this year. One of the great benefits of USF TCOP is that the area in Tampa, you're surrounded by a lot of different hospitals, and with those hospitals come opportunities for shadowing, internships, areas that you can get exposure to before your rotations, which helps kind of boost up your experiences, help you get a sense of if you really would want to do residency, what it's about. You just have a lot of great connections just by being at the school. So I think that's one major benefit. Additionally, we have a lot of great faculty at USF TCOP that have been through residency or at least know a lot about the process. I think everybody knows a lot about it. So you have a lot of mentorship early on in pharmacy school if that's the path that you're looking at. And I think that's really great. It's good to talk to somebody who's been through it and who's seen people before you go through it. So that's another great benefit as well. Ooh, a typical workday for me is different every single day, but I think one thing that doesn't change is the patient care. My institution is a really large academic medical center, so there's a lot of teaching all day, and I love that because I get to teach. I get to teach other residents, APPE students, but I also get to learn and teach other specialties like surgery residents, medical residents. It's a really, really open environment. We have 2 sets of rounds each day. So right now I'm on a kidney transplant rotation. So I get to round with the nephrology team in the morning. and then with an even bigger team, multidisciplinary rounds in the afternoon. So there's a lot of chance for pharmacists to make interventions and for you to get that autonomy really early on, which I really love. Other days are different. I have a lot of patient care activities throughout the day. Pharmacists in transplant are really involved in medications, transitions of care, so making sure that every medication is correct at every phase of care, and we educate patients on a day-to-day basis as well. Outside of that, I of course have meetings, projects to work on, but I usually leave at a decent time so I can come home and still enjoy my day and then work on other projects later in the night if I have stuff left over from the day. So every day is different, but generally they have a lot in common.